Welcome to today's presentation and our kickoff session for the National Healthcare for the Homeless Council Spring 2017 virtual training. Let's get started. You wake up, another morning, waking up in a shelter. You had one of those restless nights of sleep that always seems to happen when you're in the shelter. The guy next to you, up all night, coughing, snoring. And even for you, the nightmares sort of crept back in last night. Nightmares of not wanting to wake up homeless. Nightmares of past abuse and trauma. Nightmares of wondering where you're going to get your drugs tomorrow. How are you going to afford that? It's that sense of little or no sleep that you carry around with you almost every day of your entire life at this point. That tiredness, that frustration. There's no right side of the bed for you when you wake up in the shelter. You also on your mind, fresh this morning, is your visit to the clinic this afternoon. You're worried about it. Your foot's been killing you, and yet you know your doctor is likely not to give you more pain pills, or at least the pain pills you want. Besides that, you know you'll probably go get another lecture about medical adherence to HIV meds, and you're just not in the mood for it today. So you find some time to waste in the morning. You sit around the shelter as long as you can, go to the library, trying basically not to get high, not to use until after the clinic appointment. You know that they don't like you coming in when you've shot up. And so you're trying, but those withdrawals start creeping in. The pain starts creeping in. It makes just the frustration and the night without sleep, that's much more dramatic. So you get on the bus. You normally walk to the clinic, but your foot's just hurting too bad. So you get on the bus, and as the bus is pulling up to the stop close to the clinic, out of the corner of your eyes, you see your drug dealer. Not your current drug dealer, but the one you were using a few weeks back. That drug dealer knows that you owe a little bit of money, and he also knows that so many of his clients rely on the clinic to get their health care, their HIV meds, their pain meds. And so you just kind of chuckle at the irony that a drug dealer is hanging outside a medical clinic that also dispenses the drugs. And even though you love to right now, more than anything else in the world, go get high and get rid of all this pain for a few minutes, you don't get off at the stop that you need to get off at because you don't have the money to pay him and get high this afternoon. So you go on to the next bus stop. Now you've got to walk about a quarter of a mile with a really bad leg. Every step is pain, and that just encompasses the pain of also just the low night's sleep, the withdrawals from the drugs. And you start walking down the alley because you think if you go down the alley, you can sneak by without your drug dealer seeing you. And if he doesn't see you going in, maybe you can get out safe as well. So you walk in. The lady behind the desk is behind a very thick piece of glass, and you bend down to talk to her. She tells you that you're 15 minutes late. Just kind of chuckle to yourself because she only knew what you've gone through just to get here. But you don't. You really need these medications. You know that. Your case manager's been telling you, your foot's telling you that. So you sit down and you have a seat. And you're sitting there for 10 minutes, for 15 minutes. At this point, it's becoming a little ironic that they got on you for being late. When once again, you're sitting here just waiting to be seen. 20 minutes, 25 minutes, when you see somebody that came in after you, about 10 minutes in your mind, get called back by the nurse. This pisses you off, but you try to hold it back. You try not to yell. You try to take that deep breath that your case manager told you about, but it's just not working. You yell out even though you don't want to. What the hell? I was here first. Been waiting for 40 minutes. What the hell? Well, now you're the distraction in the waiting room. The security guard comes over and reaches out his hand. From somewhere deep inside you, a hazy memory of the night the police came when you were a teenager and arrested your father. The night the police cam did a sweep of the encampment, right when you kind of felt like you had some sense of home and community for the first time in years. The security guard reaches out, even though you like this guy, he's not that guy anymore. He's that policeman that arrested your dad, took your home away from me. And so you shove him back. Shove him back. So get away! And now you see it. It's not the first time you've seen it. Everybody's now in the waiting room. Every available staff. And you see the woman behind the desk picking up the phone, and you know who's that phone calls to. It's not to your case manager. It's to the police. And you also know if you walk out there on your own, your dealer's going to see you with all this chaos. So in the back of your head, you're like, well, at least if the police take me out, I don't have to spend all my money paying my debts to my dealer. For so many of our clients, safety is elusive. Living out in the streets, there's very little sense of physical safety. There's very little sense of social, healthy, emotional relationships. But there's also a lack of safety within oneself. We know the neurobiological injury of trauma, addiction, living in high levels of stress, damage the brain's ability to regulate itself emotionally. And when this regulation doesn't happen, you can think about it as a time bomb inside of a lot of the folks we work with. It's a time bomb. And what I've really realized after many years of sort of seeing this happen but not being able to really place what was going on is that so many folks with histories of trauma, with histories of addictions, with histories of homelessness, they don't trust themselves not to explode. So imagine walking around, walking into a medical visit, walking into your place of employment, walking into your home life after work, never trusting that you're not going to lose it, that you're not going to blow up, that you're not going to get kicked out, left behind, told we can no longer serve you. And imagine for somebody whose life is already filled with high levels of stress and trauma, what happens when we add on the stress, the worry, the anxiety about, can I hold my shit together today? And so it's a real call on us as healthcare for the homeless providers and other similar work that we do with the populations experiencing homelessness, is to really think about all aspects of our care in innovative ways. As I was working on this presentation, I had to take my dog Moose to the vet. Now, Moose is a great dog. I love this dog to death. But she's got some behavioral issues. She gets really anxious around other dogs, and she's about 75 pounds. And I think she's trying to protect us, but it doesn't come across that way to anybody else seeing it. And so it was interesting to watch. We have this vet, and the vet allows us to call up when we're outside and say, hey, we got Moose out here. Instead of coming in the waiting room and waiting with all the other dogs, they let us come in the back door and go straight into the exam room. And even though, again, veterinarian care and health care, totally different things. I totally get that. But just kind of made me think, here's a dog with a time bomb inside of her. Not her fault. She's just her breed, her upbringing on a reservation down in New Mexico. She has this neurobiology. And her healthcare provider has said, okay, she's not safe. That time bomb's not safe in the waiting room. And it's not safe for her. It's not safe for anybody else there. So they bring her right in through the back door. And it just made me think about the stories that I hear. And these aren't specifically about healthcare for the homeless provider, but I was in a southern state a few months ago. And I heard stories about clients having to sit in waiting rooms for up to 5 to 6 hours before getting seen. 5 or 6 hours. my time bomb would go off. After probably about an hour and 15 minutes, I would be yelling, "What the hell?" And so we have to really take a look at this and really create as much safety and stability as much as possible. Because our folks are not trying. They don't wake up in the morning. And this was a big realization for me. They don't wake up in the morning saying, "I'm going to get kicked out of the clinic today. I'm going to get arrested today. I'm going to get kicked out of the last case management organization that will serve me in the entire city." They don't wake up like that. They don't wake up wanting to get in a fight, relapsing from substances. They don't want to. No one wakes up and plans out their behavioral issues. So the behaviors we see are not intentional behaviors. They're just the ability, the unfortunate reality is that they haven't developed the coping skills enough to really help manage their emotional state. Again, not due to any fault of their own, but due to the trauma and stress they've experienced in their life. And so my question for you with this speech and this example is, how can you increase safety for folks? More so on an individual level. We could have a whole different talk about organizationally, socially, so to speak. But when somebody comes in for the first time to your organization, maybe just asking a question in intake is, what can make your medical visits as easy for you as possible? How can we increase safety for you? Maybe it's the fact that I have trouble sitting in waiting rooms. And if you tell me it's 10 minutes, and instead of saying you might have in a seat, but just say, "Hey, you want to walk around the block a few times? Come back in, we'll probably be ready for you at that point." Maybe having just a TV in the waiting room so I can focus on that and not everything else. But just having really quick ways. For some people that's really hard to engage, maybe you do plan it out. Maybe there is a way that we can get them right in right away if possible. I know this is challenging stuff, but we also know that the behaviors we sometimes see that can become violent, that are at least incredibly disruptive, and always hurt our ability to give the care people want, we need to address that in any way possible. So make it as easy as possible. And for most folks, especially in HCH environments, what is their safety plan? And we don't want this to be a 10-page document. We want it to maybe be 5 bullet points. If I'm feeling anxious in the waiting room, what do I do? Maybe it's to go tell a front desk person, "I need to go around the block. Is that okay?" And making sure that's okay, because again, if that time bomb's ready to go off, get me back to the exam room where now you're putting your hands on areas of my body that might have been associated with my past trauma or other stress. So having the ability to do that, teaching coping skills like deep breathing and mindfulness, all these things can help bring this down. But the points that I want to walk away with from this training today is nobody wakes up and plans out their behavioral issues. They carry around. If we don't feel safe with them, we can pretty much guarantee, and again, this is complex to put this into words for a lot of folks, even folks that aren't experiencing homelessness, that we don't feel safe with ourselves, that we don't feel a sense of safety with ourselves, and that's where the behavior comes from. The behavior comes from the biological injury of trauma and living lives under high levels of stress, addiction, homelessness, domestic violence, etc., etc., etc. So the more we can increase safety, the better outcomes we're going to get in the medical care that we're going to provide. One more challenge in an already challenging profession. But if we can take the compassion and the empathy that we have and take that a step back and operationalize it in safety conversations and safety plans, we're going to increase the level of engagement in healthcare and increase health outcomes. And we know if we can find the right mix of safety and operational efficiency, that we're going to do a better job for our patients, which often, if they can succeed in our clinic, can lead to permanent housing, mental health services, substance abuse services, and so on and so forth. This is how a lot of us change lives. Thank you for your time, your work, and energy, and I hope to see you all very shortly at the National Healthcare for the Homeless Conference coming up this summer. Thanks so much.